Hello everyone, my name is Jonah Schwartz.
And I'm Shane Woolley.
And today is our first official episode of TUTV Scope. And we're going to be covering mental health concerns at Tufts.
We'll be sitting down with some professors and some fellow jumbos to field their concerns over mental health and see what can be done to address these problems. No matter how you look at it, mental health is a growing concern among college students. In 2013, the American College Counseling Association surveyed the heads of college and university counseling centers, and 95% of them agree that there has been a trend recently of more students on their campuses having severe psychological problems. The average ratio of counselors to clients then was 1 to 1,600.
Tufts has seen the effects of this increase more than most, but counseling mental health services haven't grown along with the demand. With so many students needing counseling and other support, long waiting periods are the norm for non-emergency help.
Several student-run initiatives have stepped up to provide what support they can. Organizations like Active Minds and Ears for Peers have worked to ease the tension, but that doesn't erase the need for professional help. Especially at demanding universities like Tufts, these concerns are pressing. According to the national data on campus suicide and depression, 1 in 12 college students makes a plan to commit suicide.
Yet, according to the same source, on top of all these obstacles, 2/3 of students struggling with mental health issues do not seek treatment. We sat down with Dr. Alexander Queen, a psychology professor here at Tufts, to get a professional perspective on these issues.
Hello Tufts, my name is Akshat Rajan and I'm here with Dr. Alexander Queen from the psychology department at Tufts. Dr. Queen, we're so happy you could be with us today.
Glad to be here.
Could you tell us a little bit more about your role at Tufts before we start?
Sure. So actually, I just started here last summer. I'm a full-time lecturer in the psychology department. I also actually practice 1 day a week at a group practice where I focus on treating anxiety disorders and mood disorders.
How do you differentiate between anxiety being a diagnosable psychological problem or someone just having a bad day?
That's a great question. The primary thing we're looking for is impairment, right? And so that the symptoms are distressing and interfering for the individual, right? So it's very common and typical for college students to have worries, right? I mean, what college student doesn't have worries? So we really look at this differentiation in terms of how much time are these symptoms taking out of the person's day, how much distress is it causing for them, and ultimately how is it impairing their functioning. My overwhelming experience has been that people actually get some relief once they get a diagnosis.
What more do you think Tufts can do to address the changing and growing mental health concerns?
And so I think, more outreach could be done. I think, getting peers involved is a huge way. So, peer education. I would also encourage professors, and it doesn't have to be necessarily in psychology courses, but it could be in other courses, to try to get a dialogue in class about mental health.
After getting background information with Dr. Queen, we went on the street to talk to jumbos about mental health on campus and how the administration could do better in treating it.
Do you think the school is doing a good job in covering students' concerns and mental health problems?
I think they're a bit overbooked when it comes to the mental health services.
I've used it before, and it's kind of hard to get an appointment quickly. I've had to book an appointment 3 weeks, 4 weeks in advance. And
something they could do more is that more stress relieving things. So they only bring the dogs around during finals.
Right.
But if they had them more often, that would be nice.
It was really helpful, and the reason I stopped going is because I agreed with my counselor that I'd sort of worked through the worst of it, and she wanted to open up her space to others who needed it more immediately.
Do you feel like there is a stigma related to students using mental health services or having mental problem in general?
I feel like not as much in college, but outside of college, absolutely.
Probably, but I haven't seen it.
I think stigma might be too strong a word. I think that people don't bring it up unless they're with people they feel comfortable with.
So if you had a mental health problem, where would you seek help?
I would probably go to my close friends or the internet, honestly.
Probably my friends first, and then beyond that I would go to I have gone to mental health services for issues that I felt like my friends couldn't help me with.
What percentage of Tufts students do you think that has used mental health services?
30% or 60%. I would guess 60% at least have used it once.
30% to 50%.
40% maybe.
Oh, I don't know, probably less than half.
Actually, there are 20% of Tufts students that have used mental health services.
Oh.
Do you think that sounds surprising to you?
Well, I know like 1 in 4 have mental health issues, but I do think that more people should use it.
One of the things that we gleaned from the on-the-street interviews was that students were open to the use of mental health services, but surprised by its underutilization as a whole. Perhaps this discrepancy comes from the score of complaints that we heard, especially the wait time. So we sat down with Paige Roberts from Ears for Peers to see how student organizations are dealing with this discrepancy.
Hi, my name is Sid Divakaruni, and today I have here with me Paige, one of the faces from Ears for Peers. So, could you tell me briefly what Ears for Peers does?
So, Ears for Peers is a student-run hotline for the entire Tufts community. So we're anonymous and confidential, and we're open 7 p.m. to 7 a.m. every single night. And we're just a resource for students to call and talk about any issue they're having. I think Ears for Peers is unique in that way that we are trained in how to take calls and how to respond to issues, but we're not mental health professionals, which is almost kind of why we fill this gap in the Tufts community in mental health, is because we're very not intimidating, we're non-judgmental. We will direct them to a different resource, ask them to call back, ask them if they have any friends or family members that they could talk to about the issue in the future. We have gotten this academic year over 150 calls, which is huge for us.
What is Ears for Peers' policy on confidentiality?
We are completely confidential. Because we don't even know who the person is, we don't know, we can't disclose anything about them, and we wouldn't want to anyway.
Do you think that there are enough resources on campus for students to be able to find solutions to their mental health problems?
In general, Tufts has a pretty good resource base, including Ears for Peers. Ears for Peers definitely is filling a gap, but the administration couldn't really fill that gap because our uniqueness is through the fact that we are peers.
Thank you so much for interviewing today.
No problem.
Though Paige Roberts said that Ears for Peers is definitely filling a niche on campus, she still alluded to a need to improve mental health services on campus in general. So we sat down with Sylvia Ofoma, who's working with the Senate to weave together student resources and improved administrative help to increase the effectiveness on mental health assistance at Tufts. Sylvia, thank you for sitting down with us.
No problem.
Yeah, let's get started. Could you tell us a little bit about your role as a trustee representative with TCU?
I decided to be on the administration and policy committee, and we were trying to think up projects, and mental health was just something that kept coming up in different ways, and so I was like, maybe I'll tackle that.
So this is something that you decided to take on. Was the administration involved in any way?
Not really. It's mainly just been me and Michelle Badler, as well as a few other senators. She's the director of both counseling and mental health services as well as health services, and she's kind of been my main contact person on this.
Tufts in particular, I think you guys found out, has a higher rate of the usage of mental health services. So is that indicative of some problems inherent with Tufts, a stressful atmosphere more so than other universities? Is it a good sign that we have an open atmosphere about mental health discussion, or is it something else?
There's probably a little less of a stigma here, or people know, okay, I need to get help, rather than waiting for it to escalate to bigger problems.
Right. A common student complaint is that mental health services occasionally has long waiting times and also has the session limits. So what causes these issues, and what plans are being discussed to address them?
The main problem is we have a lot higher of a utilization rate than a lot of universities our size. So that kind of comes into play to where some people have to wait longer, some people get transferred out sooner than others. So for one thing, I know Active Minds is working on kind of getting this website or database or tool, I'm not sure exactly what it is, where students have an easier time to find providers, because I know it's really hard to find a provider in the Boston area with all of the colleges and just all of the people. Counseling and mental health services actually has CMHS liaisons to different departments. So the athletics has one, the group of 6 centers have one, the dorms have one, and just finding new ways to utilize them, like make sure that students know that they exist. It would be great if we could hire more counselors, but obviously that takes time and money, and that's like an administrative thing. And I think both like me and like mental health services, they want more counselors, but since that's like that's a harder, more expensive long-term thing to do, like trying to find a way to utilize some of the other resources they have to target students and to better fit their needs.
Is the stigma against mental health and needing mental health help, is that prevalent at Tufts? And if so, does that like impede people's access and use of the mental health services on campus?
I feel like people have started to talk about it more. However, one thing I've noticed is that people talk a lot about anxiety and depression, but a lot of things aren't being talked about. So like eating disorders, like bipolar disorder, I still feel like has a ton of stigma around it.
What can we as students in that case do to like reduce that stigma?
Start learning more about these illnesses. So like learning what it means to be like bipolar, what schizophrenia actually is. Bipolar doesn't mean you're crazy. Like we shouldn't have that stigma around mental illnesses.
Well, thank you very much for taking the time out of your day to interview with us, and good luck with your project.
Thank you.
Appreciate it. Sylvia helped give us a much clearer idea of how to access the resources on campus and how they're planning to improve them. But in the meantime, how should people confronting mental health concerns address them?
I would certainly encourage any students out there that are really suffering from anxiety or other conditions to look into help, in terms of the counseling and mental health services, or reach out to a friend or an online support group. It's okay to talk about these things.
Counseling and mental health services, I know that they get a bad rap for transitions and things like that, but honestly, I still think that would be the best place to go.
One commonality between most of the people interviewed for this episode is that they strongly urge that if you or someone you know is dealing with mental health concerns, you should reach out for help in a way that feels the most comfortable.
If you'd like to speak with an anonymous student at Ears for Peers, please call 617-627-3888 or Google Tufts Ears for Peers to find their website and instant messaging app.
Despite their lack of resources we reported on in this episode, Counseling and Mental Health Services will provide free, professional help unmatched by any other organization on campus.
Also, if you'd like to get involved with advocating for more effective mental health policy, please reach out to Ears for Peers, Active Minds, or Sylvia Ofoma's Mental Health Initiative. Thank you very much for watching our first episode. Like us on Facebook, TUTV Scope, share it with your friends, and stay tuned for the next episode.